Last week, the number of weekly reported deaths from COVID-19 was the lowest since March 2020. We have never been in a better position to end the pandemic. We're not there yet, but the end is in sight. We can see the finish line. We are in a winning position.
Today, the head of the World Health Organization, the Director General, Tedros, with that news, which is encouraging. But let's face it, there are still people dying, and I'm talking here in Quebec, and we still have over 1,000 people in hospital with COVID here. So, as he said, it's nice to hear someone say we can see the beginning, or at least the finish line from where we are. But he also went on to say we're not done yet. It's not time to sort of let your guard down. So we thought we'd talk to Dr. Chris Labos, who joins us from time to time, and talk a little bit about that. Dr. Labos, thanks for being here this afternoon. And as I said, it's better news than no news at all.
Right, and I think so. And I think we always have to weigh these things in the right context. And it's true that the numbers are improving globally, but there's still COVID. There's still a lot of COVID. And I mean, it's interesting in that globally things are better. At least here in Quebec, if you compare us today to where we were exactly a year ago, things are actually maybe a little bit worse, all things considered. But the situation is relatively stable for now. That being said, though, a lot in the future depends on how we react. And I've recently been remembering the end of the movie Charlie Wilson's War. For whatever reason, it just keeps popping into my head because it's all about the end game. I'm like, okay, things went relatively well. There were some very, very bad periods during this whole COVID pandemic, but, the vaccine rollout has, gone pretty widely. Vaccine uptake has been pretty good, and things appear to be stabilizing. But it really depends on how people behave. And the biggest threat that we have now is almost not so much the virus, but our own complacency. Because if people become complacent, if they don't get their boosters, if they take no basic protective measures over the course of the winter, well, we could see things get worse because let's not forget, a year ago, everybody was predicting the end of the pandemic because cases were low and the summer was good. And then things got, very, very worse over the course of the fall and winter because of the Omicron variant that emerged. So a lot is going to depend on whether there are any new variants and how we respond to them. And do we still have the ability to acknowledge that, things can be good now. They may not be okay 6 months from now.
It sounds a bit to me, Dr. Labos, like you think that the WHO chief his statement was a bit premature. Would you have preferred that something to that, effect was not said at this juncture?
Well, it's not premature. It was optimistic, and there's nothing wrong with optimism, but you have to temper optimism with reality, and the plan has to change as the situation changes. Could we see the end of the pandemic? Well, yes, we could, right? If we roll out the vaccines, if we get the updated boosters and we distribute them globally, things can be a lot better going forward. The problem is that we're not always good at doing what's necessary. Like, we have not been great about vaccine equity. Throughout the pandemic, we have, in many situations, hoarded vaccine doses and let them spoil rather than giving them to countries where they would be sorely needed. So we're in a position now where supply is much less of an issue than it was at the beginning of 2021. We can mass produce large numbers of vaccines. We can get them to places where they are needed, and we can control the global spread of COVID. And the more we control the global spread of COVID, the less potential the virus has to mutate and produce new variants, which is what destabilizes the situation. So we know what we have to do. We just have to do it. And long term, we have to really start thinking about issues like indoor air quality in public spaces and really upgrading our ventilation systems in the same way that 20 years ago, the idea of having air conditioning everywhere would have seemed absurd to people. We have to think the same way about indoor air quality and realize that ventilation is important. And these are things that we have to do. It's a question of, are we going to sit down and do them and realize that these are important next steps to not just treating the COVID situation now, but dealing with future airborne respiratory viruses.
So, the government's sort of take here, and it's a lot of other places, I guess, as well, has turned into a live and let live sort of advice, right? You know what's here, the precautions you should be taking, and we're not going to tell you every other week to do this or do that. You're kind of on your own. Do you think that to some degree has kept people from taking this as seriously as they should?
Yeah, I think that's part of it. I mean, it's very bizarre when you hear people talking about individualized public health. I mean, that's almost an oxymoronic term. It's like, friendly fire or, some of the other the terms that exist. The whole point of public health is to protect the public and to do things that are beyond the capacity of an individual. Like when you're talking about, air quality in buildings, office buildings and schools, that's not something the individual has any direct power over. That requires government or at least institutional investment to change. It requires, bylaws. It requires large companies to look at their indoor office spaces and say, if we want people to return to work, we have to do something about ventilation and air quality so people don't get sick. So certain things, certain big things are really beyond the individual's capacity to affect them. Yes, there is a role for personal responsibility in the same way that, with all health matters, but some things are just too big for the individual, and that's what public health is there to do. And, it used to be that public health was very interventionist in terms of, changing smoking habits, right? Pushing the public to quit smoking and to combat, the marketing of the large tobacco companies. And, it did many important things, and this is one of them. So it's not a question of, just let people do whatever they want. There is a role for the government and public health to make the situation better, in the same way that there was a role for government and public health during the AIDS pandemic. In the same way there was a role for the government and public health during the polio outbreaks and the mass vaccination campaigns that went as a result of that. So big things require a big organization behind it, and that, is supposed to be the public health departments.
So, yes, that's their role. And as individuals, I guess, that is completely out of our control. We rely on them and depend on them to do that. But then let me bring it back to the individual basis. I feel like we needed to hear this. We needed to hear that the end to COVID-19 is in sight. But do you think that helps people, that helps individuals psychologically to get them in the mode of doing what they need to do to get this over and done with? Or does it have the opposite effect? Does it make people more complacent because they're like, we're almost done?
It depends how you frame it. It really depends how you frame it. Because if you look at diseases like HIV or polio, that could be eradicated. These diseases, they could be eradicated from the face of the earth if we were able to put the resources into them. And so when you have situations like that, where you tell people, look, we've done great things with respect to polio. We're backsliding a bit right now, but we've done great things with respect to polio with HIV. It just takes a little bit more to get to the finish line. I think that can have a motivating effect on people. But depending on how you frame it, and when the headline of your message is everything's fine, which is sometimes the headline that comes out from, government announcements, that does, I think, breed a little bit of complacency. And so rather than telling people everything is fine, don't worry, look how great a job we did, it really should be okay, look, the worst may be behind us. Let's hope so. Let's hope there's no new variant. Now let's focus on the next task, and the next task should be upgrading the ventilation in schools, let's say. So it's always a question of, are you congratulating yourself for the fact that things are getting better, or are you setting new goals for yourself to continue along that stage of improvement? And that very subtle difference can really make the distinction, can make the difference about whether the public continues to engage with the messaging or whether they sort of tune out and focus on, the next big news story.
So are you hearing anecdotally or through your practice that people are, more hesitant or just not paying attention enough to want to continue to take booster shots? Because I'm starting to hear that anecdotally from friends. You're not going to bother with a fourth or whatever. Now, of course, there's a fifth. What are you seeing?
A little bit of that. I still get a lot of questions from people about timing and when and should I and how should I do it. So I think there's still a lot of interest, and unfortunately still a lot of confusion from people about when, how, when, if, right? And then they hear about the bivalent vaccines and they're not sure if they should get the BA1 or wait for the BA5 that may or may not come out. So there's still, I think, some confusion, and I think that's part of the problem. But yeah, there is. I sometimes hear people be like, we're still talking about COVID, and I'm like, yeah. We're still talking about. They're like, that's over with, and I'm like, well, no. And again, it becomes a question of, yes, the acute danger of, massive deaths may be behind us right now. And again, let's hope the situation stays as it is. But it's still an important issue in the same way that, it's no longer the early 1980s with respect to the AIDS pandemic, but HIV is still an important issue. And that's sort of the thing. It's like, can you acknowledge that the situation with HIV is better than it was in the early 1980s while still recognizing the importance of sexual education and, teaching people about the importance of HIV prevention, and do the same sort of thing with COVID. Like, okay, the worst may be behind us, but there's still important, very simple things that we need to do to keep the situation stable. Because the thing about vaccination, you don't vaccinate people when things are bad. You vaccinate people so things can stay good. And you're seeing that with polio in the U.S. now. When people are vaccinated against polio, there's no polio. And then when vaccination rates drop, what happens? You have a resurgence of polio, and now for the first time, the U.S. is back on the list of countries that has active circulating polio within its borders, which is the first time that has happened in, I think, over 20 years.
Dr. Christopher Labos, with a degree in epidemiology, cardiologist. Thank you so much for your time. We always appreciate it, Chris.
My pleasure. You take care.